Hi, how are you? Welcome back to the e-learning series on hazard identification, assessment, and control. In this segment, we're going to cover assessing risk because after all, what's the risk? I ask that simply because that's the most common question we ask ourselves. Or as safety professionals, we often get asked that question. And of course, the question you're likely asking yourself is, why are we assessing for risk when we already know there's a hazard? Well, going along with that age-old question, are all men created equal? Using that same logic, is all risk equal? Hence the reason for the assessment, among others, which we'll get into as we move through this presentation. Okay, but really, why are we assessing the risk? Well, we want to look at it first off, for quantifying versus anecdotal. Without assessing and quantifying risk, well, it becomes a matter of opinion and therefore up for debate.
We don't really care about your opinion.
Debate often leads to delayed or no resolution whatsoever. Quantifying risk also allows for planning and efficiency. The old adage of fail to plan and plan to fail rings true. Work needs to continue unabated, and being able to plan accurately, including assessing hazards for risk, is essential to eliminating or reducing downtime, and therefore reducing loss. The other thing is we want to prioritize risk to maximize prevention efforts. The higher the risks with higher the consequence should be dealt with and can be dealt with first instead of chasing low-hanging fruit, which will inevitably increase risk. It also increases organizational awareness. Above all, when you're assessing hazards and involving workers familiar with the tasks and processes, they become acutely aware of hazards. And if they haven't thought of them already, the process of hazard and risk assessment will actually do that. Having said all of this, unless everyone understands what risk is, it's going to be a tough journey for you as the safety professional. So let's look at that, shall we? Risk is the probability of experiencing negative outcome or loss if exposed to a hazard. The definition also goes on to say this same risk may be applied to a situation where equipment or property loss is involved. Risk can be better described as the probability of experiencing a negative outcome or loss if exposed to a hazard. I understand when talking purely about risk management, there are positive risks too, but this is not the aim of this program. We want to discuss hazard identification, assessment, and control. So we want to view risk in that scope, negative risk, which will be, for the most part, like I said, a loss or negative risk. However, there is one positive that we can always look at as safety professionals. We will never let a good crisis go to waste. We'll learn from it. But let's move on, shall we? And that is the whole point. To understand risk is the probability of loss if exposed to a hazard. However, what does it take to understand the risk? We also need to understand consequence because many people equate risk or hazard with consequence, but they're not synonymous. Consequence is the negative result after exposure to a hazard resulting in loss. So when considering this definition, we also need to note risk may be applied to the situation where equipment or property loss has been experienced. Consider it this way. If property has been damaged, would it, in different circumstance, that same impact of force, had it been exerted on a human, cause more loss? Think about it. The next thing we got to think about is, with that, is there's always a loss. The loss may be people, property, time, or money, but regardless, there's always a loss. With a near miss even, you need to investigate near misses, and investigations create downtime. Downtime means loss. So let's look at the confusion around quantifying risk, shall we?
Yeah, let's do that.
Quantifying risk, after all, we want to give more than our opinion. Opinions are often based on feelings, and nobody cares about feelings. So let's just give them facts. And some of these different confusing issues are, well, polarization is one. Polarization of possible loss is an issue. By this I mean there will be folks that will minimize the possible loss, therefore they'll minimize the risk. And of course the opposite, people that will maximize everything. The other one is not understanding frequency. Many people think when they're trying to calculate exposure or frequency, they think of the number of times or the rate or repetition a task is performed. It isn't that. Consider frequency is how often you're exposed to the hazard while performing the task. Look at ladder use. Risk will go up the more times that you go up and down a ladder where you're exposed to falling from that ladder. The same thing with garbage bags for janitors. Small bins versus large bins, or what do those bins contain, is what's going to create a different risk. The other one, of course, is not quantifying probability. We need to quantify all points of risk. If not, it goes back to the same problem, one of being anecdotal and the other one being objective and measurable. And the next one, of course, is oversimplifying or overcomplicating the process. If it's too simple, it won't give you, or it will not give you, an accurate measurement. And of course, if it's too complicated, there's even a greater risk because either it's not going to be done or it's going to be prone to errors through its complication. Now, when it comes to quantification, there's different methods. Which one you use will be up to you and, of course, the needs of your organization. So the first one is frequency, and it's very simple. Frequency plus severity equals risk. Another one to use is frequency plus severity plus probability equals total risk. Or frequency plus exposure plus severity equals total risk. Now, there's many more. I will be outlining some more advanced methods in a future course and future videos on YouTube, but for now, we'll just go over the three that I've outlined. When we're quantifying risk, we want to do it by providing objectivity by the numbers. In the hazard ID or hazard identification process, we split duties into tasks and then quantify the risk based on the exposure to the hazard and the probability of experiencing consequence when exposed to the hazard. The important point to note here is to provide objectivity by giving each assessment criteria a numerical value. However, a word of warning here, don't complicate it. Okay, so now what we're going to do is we're going to look at some examples of quantification. And let's look at the first quantification criteria, which is frequency or time. On this note, this is how often the worker is exposed to the hazard when they're performing the task, not how often they repeat the task. So we're going to look at daily. We're going to give it a score of 4. Weekly, we're going to give it a score of 3. So weekly is 3. Monthly, 2. Annually, 1. Now, let's look at the next one, which is severity. So let's look at severity, probable loss. On that note, probable, not possible because many things are possible, but they're not always probable. We would score each point as thus. The first one is inconsequential, 1, meaning nothing has occurred or the injury or damage is inconsequential. Think of a red mark on the skin or very little pain, a walk it off scenario. The next one is treat and RTW, or return to work, 2, where the worker would have to see first aid, but the injury is minimal and they could simply return to work with no impact on their duties or very minimal accommodation. The next one is hospitalization and RTW, or return to work, and we're going to score a 3. The worker may have to go to the hospital, but will return to work in full capacity or with minimal or no accommodation. And finally, the last one is life-altering, 4. This is where the worker will need to be accommodated for the rest of their life, or they may not return to work at all, or worse. So before you quantify or to simply do this, to quantify your risk, you simply add each score together. So to quantify your risk, you simply add each score together. You add your frequency plus your probable severity equals risk. It's that simple. So let's look at another example with a bit more complexity. This one uses the same process for assigning value to a frequency based on how frequently the worker is exposed to the hazard. Once again, daily, 4, weekly, 3, monthly, 2, and annually, a score of 1. Once again, the severity or probable loss is calculated in the same manner. Inconsequential, meaning nothing has occurred or the injury or damage is inconsequential. Once again, think of a red mark on the skin or very little pain. Once again, a walk it off scenario. The next one is treat and return to work, or treat and RTW. We'll score a 2. This is where the worker would have to see first aid, but the injury is minimal and they could simply return to work with no impact on their duties or very minimal accommodation. The next one is hospitalization and then eventual return to work, or RTW. We'll score that a 3. The worker may have to go to hospital, but will return to work in full capacity with minimal or no accommodation. And then finally, the last one, once again, is life-altering, or score a 4. This is where the worker will need to be accommodated the rest of their life, or they may not return to work at all, or worse, may be fatal. The next point is where we're going to dive into a bit more complexity. And this is where we're going to dive into and we're going to talk about probability, or the chance of realizing loss. It's a bit more, and we're going to assign each of the criteria a numerical value. Now, extremely remote is going to be 1. This is where the incident has never happened before, nor has anyone experienced it before. A 1 in 100,000 chance, so to speak. The next one is, has it occurred? We're going to score a 2. This is where the incident or the impact has occurred, but not something that's occurred with any recalled frequency or remembered frequency. And maybe even a one-off, so to speak. The next one is a 50-50 chance. We're going to score that a 3. This is where the task is known to create both the exposure to the hazard, but also an experienced consequence, whether it be a near miss or close call, or an actual injury, or damage 50% of the time or greater, but not every time. We're going to score that a 3. The next one is expected loss. 4. This is severe, where every time the task is performed, something bad could happen or is going to happen. So what we end up with here is a different equation. We end up with frequency plus probable severity plus probability equals total risk. Once again, we are adding each together to come up with a quantification for the risk based on objectivity, not an anecdotal opinion. So let's look at another example. And once again, we're going to use the same process for assigning a value to frequency based on how frequently the worker is exposed to the hazard when they're completing the task. Daily is, of course, 4. Weekly is 3. Monthly, 2. Annually, 1. Something different, though. We're going to now look at exposure to the risk by considering the repetition of the task and frequency in the given period. Basically, this is how many times we're repeating the task within a given period and being exposed to the hazard. Looking at it as total exposure, shall we say. So 1 to 5 times, we're going to score it a 1. We score it if the worker is only repeating these tasks 1 to 5 times in the given frequency, such as they're exposed to the hazard on an annual basis, but repeating that task 1 to 5 times in a year. Next, we're going to score 6 to 10 times, and we're going to score that a 2 if they're repeating that given task 6 to 10 times in the given period. We're going to score it a 2. Think of a janitor that is emptying garbages that are known to contain sharp edges daily. They need to empty 8 garbages, so we would score them 4 for the times that they're exposed to the hazard, then 2 for the amount of times they're exposed to the risk. So once again, they're doing something daily is a 4, then they're repeating it in a given time period, we're going to score it a 2. So it changes the idea on exposure. The next, we're going to look at 11 to 15 times. 3, is what we're going to score it. Once again, the score is at 3 if they're repeating that task 11 to 15 times within the given period. And then 16 times and up, we're going to score it a 4. So once again, that idea of you're exposed to the hazard is a frequency. The exposure Total exposure is how many times you're repeating that task being exposed to the hazard. Then, of course, the next thing is we're going to score probability. Once again, the chance of realizing a loss. We're going to score 1 is extremely remote. Then we will score probability or the chance of realizing loss, similarly as before. Extremely remote, 1. This is where the incident has never happened before, nor has anyone experienced it before. A 1 in a million chance, so to speak, of it occurring. Next, we're going to score 2 for has it occurred. 2. This is where the incident or the impact has occurred, but not something that has occurred with any recalled or remembered frequency. So a one-off, so to speak. Next, we're going to score 50-50, or better chance, 3. This is where this is where the task is known to create both the exposure to the hazard, but also an experienced consequence. Whether it be a near miss or a close call, or an actual injury or damage, 50% of the time or greater. We're going to score it a 3. I had a case where almost every single time workers were pushing a button to close a bay door, that bay door would slip on the gears. And they were saying that to me, they said, well, it's almost every second time. So in that case, because that hazard is present every second time, and nobody got hurt, but that there was a close call every second time, then we would score that a 3. Does that make sense? And then finally, an expected loss. This is where we would score this a 4. This is severe. This is where every time the task is performed, something bad happens. So think back to that bay door, and every time they press the button, it would slip in the gears and the door would slide down. Every time. So now what we would have here and what we would do is we would add it together using all of these quantifications, and we would come up with frequency plus exposure plus probable severity equals risk. Once again, this is all depending on your needs as an organization and how granular you want to get in analyzing your risks. Some organizations want an in-depth picture, where others do well when it's just scanning the surface. It works for them. Consider it this way. Do you need to have certificate of recognition, or are you looking for core status? In which case, then there has to be a way for quantifying and prioritizing hazards. But if not, maybe a simple method might work for you. So let's move on. Let's look at creating risk ratings and how we go about that. We look at our risks as qualified by quantification using a risk rating. We can then take and rate each task like so, as you see in this slide, dependent on scale, meaning which quantification method, the ones we just reviewed, that is used. So if we used a simple one, we might be looking at 2 or 3 as low. Or if we used a more advanced method, we might be looking at something with 3 or 6 because we have higher possible scores. Same thing with medium, might be 4 to 6. Or if we're using an advanced method, it's 7 to 9, or an intermediate method. High is going to be 7 to 8 if you're using simple, or 10 to 12 if you're using a more advanced method. When we look at it this way, it's now no longer an opinion. We have quantified our risk, and you can look at punching the values into a heat map or a similar process if you want. So once again, risk is qualified by quantification. You can proceed logically. Think of it this way. The old business adage is, what cannot be measured cannot be managed. So we can then consider probable loss. Is it low, medium, or high? We're looking at the risk. And usually increased risk equates to an increased chance of loss. And then we can figure out separation or segregation of our risk. We can plan accordingly, okay? And that becomes the problem. If we're not qualifying and quantifying risk, then we can't plan accordingly. The other thing is, quantifying your risk aids in consistency. It isn't about opinions anymore. There are values attached, and it helps you to develop cases for prevention if you need to. So, a point or two. Use your own corporate history or industry sector history when determining quantification metrics. So, in summary, we want to look at it this way. Hazards adversely affect safety and health of people and cause damage to property and assets, leading to loss. So, there's always a loss, no matter which way you look at it. Okay? The other thing we want to look at is risk is the probability of loss occurring after exposure to a hazard leading to loss. Understanding the hazard and the probable risk provides better opportunities for control and the ability to maximize efforts at controlling hazards. So we've hit that spot. It's quiz time. If you're watching this on YouTube, if you're not subscribed already, what you want to do is you want to hit that little subscribe button down there and ding the bell. That way, when the next video in this series launches, you'll get notified. And that's provided you click the little bell. If you're on the learning platform, there's going to be a short quiz that you will need to take to ensure this module is complete. Once it's done, you can move on to the next module, which is understanding controls. Oh, and for you folks on YouTube, you can check out this video up here. Remember, safety leaders here. Being a leader is doing the right thing in the right place at the right time, regardless of who's watching, because more than likely, someone is. Okay? Take care. Bye for now.